newcomer to the University of Alabama team, and welcome. Thank you very much for joining us.
Hi, thanks Vinny. Thanks also PM&R Scholars in general for putting this together. I know it's stressful for students and programs and everyone trying to get to know each other, but we're really excited to come and meet you guys. So I am Mona Ahmed. I'm a PGY4 and the admin chief at the University of Alabama at Birmingham. We're not the big football school, unfortunately. We're just an affiliate in Birmingham, but big college and medical center for sure. So it's not clicking, there we go. So just some information about UAB Medical Center in general. It's a big academic center. We have 1,200 interns, residents, and fellows. There's 93 residency programs there, which is nice. A lot of support from other programs when we need them for our own patients. We are a level 1 trauma center, so we do get a lot of those high-level spinal cord injuries, traumatic brain injuries, polytraumas for sure. A lot of faculty, a lot of outpatient visits, ER visits, and then a lot of affiliates around Birmingham as well. We have an eye hospital, we have outpatient clinics, we have our rehab center, of course, we have a cancer center, women and infant center. So just a pretty big medical center spanning, I think, 120 blocks. The affiliated places that we work specifically, and we'll talk a little more about this in detail, we have UAB Highlands, which is generally an inpatient outpatient center where we do a lot of our MSK and pain clinic. There is a children's hospital where we have a peds rehab floor for those rotations. There is a VA that we're also associated with for outpatient rehab services. And I'll skip the last two because we'll talk about call a little bit later and cross-covering. Spain Rehab Center is an independent rehab hospital that is associated with UAB. We were started in 1964. We are a 49-bed hospital, and we have 3 floors basically that the patients are in. It is freestanding, although we have the support of rest of UAB whenever we need it. We do have our own spinal cord injury unit with specifically trained spinal cord nurses and therapists and social workers. And then we also have a security locked brain injury unit for the patients that kind of need that a little more. And then we also are part of the SCI and TBI model systems. I'm sure you've heard about the model systems from other programs, but just in case you haven't come across it yet, it's essentially a great central database that a lot of research can come out of and collaboration. So our spinal cord and TBI patients go into this database that we can all use for research. So we've been part of the SCI model system since 1973 and part of the TBI model system since 1998. And we really love having access to that as well. I showed you before this Spain Rehab what it looks like now. We're actually getting a new building, which we're really excited about. So here's just kind of the plans for the new building. Lots of windows, I don't know, modern. There's a gym on every floor, collaborative workspaces. I'm sure you've heard it all before, but we are really excited to get it because we've had our old building for a long time and it's our turn. So a little bit more about the program. The residency program has been here since 1971. We have 22 faculty in the program, and we have 4 residents per year, 12 residents in all. We don't really have any fellowships associated specifically within the PM&R department. There is one PM&R fellowship position at UAB in the anesthesia department for pain, for interventional pain. And then there's also a non-accredited interventional spine program in Birmingham that we have pretty close ties with as well. The faculty there will come give us lectures, and we do rotations there a lot as well. Though we are an advanced program, we have an attached prelim year that if you choose to take it, you would have a spot there. So our attached prelim year is at Brookwood Baptist. It's an internal medicine prelim. These are the program directors, Dr. Townsley, Dr. Rogers, and it is optional. You could choose to do your prelim year anywhere else, but if you were to match here, you would have the option to automatically get this prelim year as well. So it's pretty nice. Most of us take advantage of it, and it essentially turns into a categorical program when we all get to know each other really well before we start. These are the two hospitals we work at, Princeton and Grandview. They're both part of Brookwood Baptist, and it's just a good all-around internal medicine experience, and we can talk about it a little more if you guys have questions. Once you get to UAB, the curriculum, so for PGY2, it's pretty heavily inpatient based. So you'll do your TBI, spinal cord, stroke, and 2 months of our general service, which is a lot of the polytraumas and debility patients, and 1 month of outpatient in the MSK clinic. So kind of concentrated there. And then when you're in upper level, you do your consults, you'll work at the VA. We get a lot of EMGs, peds rehab, outpatient clinics, which we'll go into clinics. We have a lot of pretty specific clinics. We do cancer rehab, palliative care, and then 1 month of inpatient mentoring, which is just an inpatient experience we get to have as an upper level, because a lot of us don't get that. And then we offer 4 months of electives and selectives. And just going through more of a specific sort of schedule, what we're doing this year. So as you see, the PGY2s, they're doing their 3 months at a time of inpatient, and those are all in blocks together. And then as an upper level, you get a mix of electives. Sometimes you go back to inpatient, you do your EMGs, your consults, peds. And then as a fourth year, you get 1 month of peds, 1 month of consults, but then a lot of those a little more specific outpatient rotations like sports, cancer, industrial, you get your electives and your selectives. So that's very good. For our didactics, we get 5 hours of didactics a week. So on Mondays, it's generally journal club or clinical cases, or the department quality improvement meeting where we all talk together about quality improvement things at Spain Rehab. Residents present journal clubs and clinical cases. We'll do 1 a year. And then we also do QI projects, which I'll talk about a little later. Tuesday through Thursday at noon is when we do our faculty and resident didactics. That's faculty within the PM&R department, but we also heavily use faculty from across UAB to get their expertise too. And it's organized by topics. So we'll do like an MSK block and an SCI block and a TBI block. And we restart that curriculum every 12 months. So you'll hear each block at least 3 times by the time you're taking boards. And then on Fridays, it's our grand rounds at noon. And all of these are protected, so we forward our pagers to the nurse practitioners that are helping us on our services, and we are not disturbed during this time, which is really nice. We can focus. We do have required research and QI project that we need to do when we're at UAB. So both research and QI is just any topic of your choice. You pick whatever faculty mentor you want. You don't have to publish, but I guess it's cool if you can. And then if you do get something accepted to a conference, then the department will fund your trip to that conference, which is really, really cool. I got to do that at AAP this year. I went right before COVID started, and it was, I went to Disney World, and that was good. But anyway, so, and then for call, which is like the big thing. So we have in-house call, and they are 24-hour calls. The nice part is you do get a post-call day the next day for your day off. So PGY2, there's a little more in-house call, then you're doing more of the weekends and holidays as well. PGY3, no weekends, no holidays, but you're taking more of the weekday calls, and some of the rotations like peds rehab, you'll have home call once in a while. And then we do consult calls on the weekend where you just come in for a few hours and do a few consults, whatever's come in on Friday or Saturday. And then as PGY4s, you also do kind of minimal in-house call, maybe 1 or 2 a month, and then also help out with the consult coverage. If you're a PGY2, then you're generally inpatient and you will leave your call after rounds. And then as a PGY3 or 4, you generally leave at 7 when your call is done and just enjoy the day. We have a good representation of, residents from all around, a good mix of MDs and DOs, which I really like. I always have been a little more interested in OMT. And one nice thing also is if you're a DO and you want to keep practicing your OMT and use those skills on your patients, we do allow you to schedule clinic visits for your patients just for that. So I think some people in our program have enjoyed that. For quality of life in general, um, sorry, I like how it says happy residents because, like, I don't know, it's very convincing, but we are happy in general. We do have good camaraderie. Like, I feel like I could tell you this, it does suck that you guys can't come and see that, but we really do all like each other a lot and get along really well. The city's pretty good. I've lived in big cities before, like Atlanta and Chicago, and I didn't expect to be in Birmingham, and I like it a lot more than I thought I would. There are still a fair amount of activities here, whatever you want to do. One thing I love is low cost of living and no traffic, especially coming from Atlanta. But the music scene is great. The food scene is great. I mean, I've never run out of things that I've wanted to do here, and there's still stuff that I'm missing. So it's pretty good. Benefits of the program. So we get 15 days for vacation per year. You can divide those however you like, make long weekends or make a whole week of it. Outside of those 15 days, you also get additional days of educational leave, 3 to 7, depending on what year you are. So if you want to go to a conference, you just use your educational leave days. You don't have to use your vacation days. We get a stipend for books or board resources or whatever you want. We pay your license fees. We pay for your PM&R membership. The university pays for your insurance and malpractice. We give you a Bradham's, an EMG book, also Cucarolo, I think we left that out, and a PM&R Q&A book with the app. And then we get 2 resident retreats a year, and I'll talk a little more about what those are. And then here's just an example of the stipends that we have. We only go to PGY 4, I guess. So, and then for wellness specifically, we have a resident wellness committee. I'm on that as well. We meet once a month to talk about like wellness curriculum. We talk about wellness activities that we want to do for the residents. In our lecture schedule, we have one wellness day a month that we don't have lecture, and we kind of talk about, are we going to go out for lunch that day? Are we going to do a lecture, a wellness lecture, or something like that? We have a departmental wellness committee, which is like above us, sort of for the faculty and the research department and all of that. They maintain a wellness fridge, which is really nice with a lot of great snacks. We have monthly chair massages, monthly yoga sessions, and they send a wellness newsletter with resources just for helping out. We have a faculty mentor that helps out with us through our training. We get our wellness days off from lecture, 2 resident retreats a year. So the resident retreat is basically all 12 of us just have the day off, and in the morning we all try to do something service oriented together, and then in the afternoon just something fun. So this year we were supposed to do go-kart racing, but that got canceled because of the pandemic. And what did we do last year? We've been hiking, axe throwing, like an arcade. I don't know. I can't remember what it's like to hang out in big groups of people anymore, but they were fun, I remember. And then the PDs are honestly like super cool and great and very approachable. So whenever we need them, we're able to go in and do that as well. We have a few ways you can connect with us. So we have a Twitter if you're not following us already. Let's see, it's at UAB PM&R. We're very serious about the and in PM&R. I don't know why. So you can follow us there and connect with us. And then we're also, if you want, we're going to basically do more detailed sessions of all that information you just got on August 6th, September 10th, and October 8th. And if you want to come like chat with the faculty, chat with the residents, a lot more of us will be on those calls. So if you go to uab.edu/rehab and you want to join us there, if you reach out to me, I'll give you my info. We can set you up with that if you're interested. And I talked too fast, so I finished the presentation already. But if you have questions, you can reach out to me. There's a really bad picture of me here. I didn't know it was going to be picture day, and I wasn't ready. There is my program director, Dr. Kirksey, the APD, Dr. Powell, our program coordinator, who is amazing, Lauren Hanhauser, and then Pierre Galea is my co-chief. He's the educational chief at the program. We are all really excited and happy to answer your questions. And yeah, if you have any questions, I'll be here for the rest of the meeting, I think maybe for the next half an hour actually, and you can leave them in the chat and I can help you guys out with anything, answer anything.
Excellent.
Yep.
Thank you very much. You still have 5 minutes left on the clock. So if students want to ask questions on the chat, they can. And if you have the chat open, you can read the questions and just answer to them right away. You still have 5 minutes on the clock. And there you go. Some questions are coming up.
All right. Are your sports rotations affiliated with Andrews Center? We have faculty from Andrews come and rotate with us, and we can do elective rotations there, but our sports, oh, sorry, we're changing our sports rotation. So I think we will have some days at Andrews Center with sports. Great question. And we can moonlight, starting from PGY3, we're able to moonlight. There's not a lot of opportunities within the department, but people will do urgent care moonlighting or within the rest of UAB, but we're allowed to. Sports coverage, I don't know the specifics on that, but I did have a resident friend last year who liked to do a lot of sports coverage, and he worked with people within the sports medicine department to do that, and they know us pretty well and they're very open to that. If you are doing sports coverage, I don't think it's for any of the big teams. It'll be more for like local high schools and stuff like that. Any other questions? Yes, so we took out the slide of like where people essentially go afterward, but, and I wish I had it with me, but like within the last few classes, 4 people graduate. 1 will usually go into academics, they'll stay at UAB or go elsewhere. 2 will go into fellowships, and like 1 will go into private practice. And if you come to our other sessions, I have more details about that. I just don't have them on hand, but it's generally a good mix for sure. We just have really the faculty mentors, asking about a mentorship network. We have like within the department our own faculty mentors, but that's about it. We don't have anything more specific than that. All right, thanks guys.
All right. Thank you very much, Mona, for your presentation. Excellent. You still have 2 minutes left, so I would suggest that you share your email in the chat box there so students can reach out. The other suggestion that I have is if students have additional questions, please visit our website at pmnrscholars.org. You'll find the forum there. On the forum, you have a specific part that is relevant to the Alabama session, and then students can ask questions and we can, you guys can answer that, and we can also get in touch if needed. So thank you again for joining us tonight, and we really appreciate your presentation.
Thanks, Benny. Thanks, everyone.
All right. With that,